Okay, well, you've just hit the hour. So I'm current president of SEGH, Professor Jane Entwistle. But today I'm chairing the session, and it's wonderful to announce our guest speaker today, Professor Akinade Olatunji from the University of Ibadan, Nigeria. He's Professor of Applied Geochemistry. He's also a past president of SEGH and one of our current fellows. And it's in that capacity as a current fellow of the Society that he will be talking to us today. He's going to be talking about snippets from Nigeria, evolution and state of the science of environmental geochemistry and health. So I'll pass straight over to Aki, if I may. Over to you. Thank you very much.
Thank you very much, Jane. Thanks for the introduction. And I want to welcome everyone to this talk. Our the talk is just to give us as titled a snippet into what we have been able to do in terms of our contribution from this part of the world, with assistance from some of our colleagues across the globe. I hope the audio is fine.
Yes, it's fine.
Great. So before I start, I would like to say that, all right, proud to the prevalence of internet. A lot of research had been undertaken by individual scientists in the country that has to do with environment. Most of those research are not currently available because they are buried in journals that are not online, that's not available. And some of those references are difficult to actually cite and see. What I've tried to do is to look at a synthesis of some of the work that have been done, that are available and that can be verified, and give an overview of what our contribution has been from the early 90s to this moment. How did this all start? The first attempt to apply geochemistry in this part of the world was the pioneer work done by Robert Ox and John Webb, somewhere in the southeastern part of Nigeria, where they were exploring for lead and zinc. And of course, it was strictly looking for chalcopyrite, pyrite for mining, and ultimately, because of the effects, they also looked at some of the natural waters and the vegetations in the environment. So that kind of pioneered the application of geochemistry into looking at environmental media rocks in Nigeria. And of course, their effort led to the 1962 classic, Geochemistry in New Exploration, has been cited. Now, from the 80s to the 90s, a lot of targeted investigation were undertaken by various workers, especially around the southwestern part of Nigeria and Lagos. Most of these pioneers were not originally geologists. They were actually they were chemists, environmental chemists, at the Department of Chemistry at the University of Ibadan. Amongst these legends, we call them legend in this part, is Professor Shebadio, Professor Ajayi, Professor Oniawa. They are all retired now. They were all very experienced environmental chemists. What they were working on were looking at things like mosses, sediment, tree barks, root dust for lead contamination. And in their research around that period, they were able to report lead concentration that ranges from 17 to 1,080 kilogram per gram for them as chemists. And of course, the victim, the cause that they identified was the atmospheric particulate from leaded petrol. Because around those periods, Nigeria used to, our petrol were leaded, and that was what was common in the market. So those were the pioneers who actually started the work about environment in this part. And their work was globally acknowledged to the extent that a Basel Center was approved for the University of Ibadan, and the center is still operational till now. In the pre-2000s, we had a rapid expansion of population in urban centers. Awareness were beginning to grow about the impact of this development on the environment. People were beginning to ask questions about the impact of the unplanned urbanization on their quality of life. And individuals were beginning to think how this unplanned urbanization and unplanned industrialization have effect on them. But basically, there were no data to point to. And in the early 2000s, a systematic urban mapping of some of these cities started. And of course, this was spearheaded by our late mentor and supervisor, Professor Festus Abimbola, who, working with some of us, myself and other one day, and quite a number of people who came much later, we started working on having comprehensive, extensive urban geochemical mapping to determine the quality of the environmental media. This started very early in the 2000s, and of course, we then started applying the method by the Forex as stated in the Geochemical Baseline Commission publication. It wasn't very easy, but we had to innovate as to be able to ensure that as much as possible the sampling is done in that regard. This slide is the evolution of the methodology that was applied in the work so far from the 50s to the present. You can see that in the 50s, the dominant media sampled were vegetation and water. And as I said, because the people who were doing the work were chemists, most of what they were using was emission spectrography, and we're looking for minerals. Then we moved to targeted urban investigation in the 80s and 90s, where the pioneers I mentioned earlier started looking at impact of environmental pollution on road dust, on the mosses, and using basic absorption method. The targeted PT there was led, and of course, a lot of publication came out from that in the period. In the 2000s to present, as I said, we started focusing more on applying real classical geochemical methods, environmental methods into studying this media. And we have worked on wetlands, lagoon, soils of urban center, geophagic clay, and the rest. Of course, the analytical methods have fully improved. We have had access to cutting-edge analytical instruments outside the country, especially the ICPMS, and also researchers also began to use available geochemical statistical method for the evaluation, and we begin to have broad spatial industrial and anthropogenic maps for our cities. Now, I'm going to show a few of the examples of some of the things that have been done, and mention maybe 1, 2, or 3 examples of how this has also improved people's perception of environmental issues in Nigeria. Lagos is the primary center of our focus, especially for my research. Of course, Lagos is the most populous city, is the most urbanized, the most industrialized, and of course, in terms of economic value, Lagos is the 5th largest economy in Africa. It's a city. Lagos is our own New York, or like I would say, Lagos is maybe our own London. But this city, over the years, have attracted population from all over, and the pressure has been on the environment. It's the most densely populated city in the world. Currently, the estimate of the population is in excess of 20 million. So we started looking at series of environmental media in the city to see what the impact of these unplanned rapid urbanization and industrialization have. And it involved looking at the water quality, looking at wetland sediments, looking at the lagoon water, looking at urban agricultural field, looking at road dust and soil. And of course, the result has been extremely illuminating. And what have been revealed is that there are extreme geoaccumulation of copper, lead, and zinc from industrial effluents. Of course, lead is also a big problem, reaching heights of several hundred foot in the soils, especially the soils that are used for urban vegetable agriculture, which is much more, 25 times even higher than the Canadian prescription for what lead should be in agricultural soil. So our work on Lagos had brought in data to let people know that rather than the usual summarization of Lagos is polluted, we can now specifically say, yes, the pollution is as a result of this, and this is actually the value. Because we're able to put value to this policy makers' view have gradually begun to change to try to look for solutions to the environmental issues. Recently, just about a few days ago, I was informed that the Lagos State Ministry of Health had actually convened a technical meeting to start looking at the issue of lead pollution in humans in Lagos. And of course, some of this baseline work we have done have served as very good sources of correlation and begin to look at how this can be ameliorated. Another thing is we have also focused our research work on clusters of industries. There are what we call industrial estates in Nigeria, and in such industrial estates, you have companies built up for various activities, manufacturing, some packaging, some recycling. One of the things we have discovered is that because of the lacks in enforcement of regulation, most of these companies have not really been treating the effluent properly. They claim they do, but from our research, from some of the experiments we also carried out, we discovered that the wastewater emanating from some of these companies, textile companies, steel companies, and the rest, are actually untreated, and they are laden with heavy metals, with lead, with zinc, manganese, copper, and these are things that ordinarily should not come into the environment. They go into the environment and they pollute the environment. We have also been able to put figures to such impact, and it's beginning to create the necessary traction in the mind of the policymakers. We also, as group in the country, have been looking at effect of dust. During the dry period in Nigeria, the dust issue is always a major concern. And we will of the view that if the soils, if the road soils and the normal soils are so polluted, then there may be a pathway that this may have even gotten into the dust. And of course, we started some work using petri dishes at the beginning, graduated later into using a vacuum sampler, take particulate matters from industrial area, from residential area, from educational environments to see the quality of the particulate matters and dust that individuals interact with. One of our earlier work was around the Shagamu cement quarry. And in that work, we observed that the dust generated from the cement quarry was actually enriched in elevated cadmium, lead, copper, and zinc, and of course nickel. And in looking at the primary materials, which is the shale and the limestone that were used as raw materials for the cement, we discovered that all those elements actually from those shale and the limestone. And so what should ordinarily have lied immobile in those materials ended up being introduced into the environment because of the dust generated after grinding of the materials for cement. We had attempted at some point to see if there's any correlation between the quality of this environmental media we have worked on the health of people. We are very superstitious in this part of the country, so it is very difficult to get human to cooperate with you to give you their materials for analysis. So what we did was to look at archives in the hospitals and see if there is any record that shows correlation between what we are seeing in the environmental media and the kind of health conditions people were coming down with. For the Shagamu area, we archived about 4-5 years of data, 2000, 2004, to look at the case being reported on the hospital. And we discovered that within those 4 years that were reviewed, there were astronomical increase in respiratory diseases and even in the level of cancer. The question is, are these industries responsible for this? We cannot say, but these are people who came to the hospital, and of course, these were the cases recorded. And we all know that definitely, if you are inhaling factory quarry dust, it is going to exacerbate respiratory disorder. So, but as I said, we were able to track if these individuals were actually within those areas. But the record shows that the kind of diseases that are beginning to come to fore at the hospital are things that can actually be linked to compromised environmental quality. One of the work that we also did and which has attracted some interest has to do with looking at geophagia clay. In a lot of communities in Nigeria, especially in the southern part and southeastern part, women especially consume this clay, especially when they are pregnant, because they feel assist them in combating nausea, which are usually associated with early pregnancy. The question that came into mind after looking at other people's work from other parts of the world was like, is the clay being consumed by these indigenous people? Is it healthy? What are the PTEs that are contained in them? And to our surprise and to our consternation, we discovered that the clay that they were taking actually will have enriched lead, arsenic, and nickel. And of course, as I mentioned, these were things that were taken by the pregnant women. Unfortunately, we could not proceed to to have interaction with the pregnant women. As I told you, there are a lot of concern here about taking human tissue for analysis. People will believe they will believe you are doing science for science only. So, but of course, we know that that's a pathway to having these potentially toxic elements or potentially toxic metals into the human ecosystem. So, it's something we have been calling the attention of people to, for them to be extremely careful and cautious in continuing these traditional practices. This slide shows some of the community where some of our work have been undertaken, and they are published, and they can actually be seen. If you see very well, it has actually concentrated in the southwestern part of the country where my university is cited. We have other examples from North Central and South South, but I've decided to focus on just this few. Let us know the kind of thing we have been doing within the country in the last 25, 26, 27 years in helping to improve the body of knowledge as to the environmental geochemistry and health of our nation. Of course, as I said, in the industrial estate, we had observed that the untreated wastewater from steel and textile factory had atrocious concentration of potential toxic elements. And the Shagamu quarry, it was also observed that the dust actually coming from the quarry are enriched in lead and zinc, which are primarily sourced from the limestone and the shale. And the dangerous thing about this is that the Shagamu quarry is just one of a set of quarry sited along a very long stretch, up to 30, 40 kilometers, lying on the Ewikoro limestone. Every one of them used the Ewikoro limestone as the raw material. But the second biggest cement factory in the continent, owned by the biggest cement company now, which is this Dangote Cement, is also sited along that axis. Now, the question is, what quantum of effort have been put in place to ensure that these dust that are generated actually reduced and contained and not made to be dangerous to people? Of course, for Lagos Metropolis, we have extensively mapped the urban sediments and the urban dust, and there are a lot of geochemical maps have been produced for a lot of the potentially toxic elements. Not only that, we went ahead to actually do isotopic study of the lead to be able to confirm what was really responsible for the lead concentration we were seeing in the environmental media, and also went ahead to do station analysis to know the form of all the PTs so as to be able to make a firm conclusion and recommendation as to what needs to be done. Of course, we discovered that most of the PTs are all in environmentally sensitive phases, which can easily be removed into the environment and get into the ecosystem or into the food system. Of course, the Lagos Lagoon was the original place where we started our work, and the lagoon, from our study, we have been able to partition it into impacted area and non-impacted area. We have been able to isolate those areas that are impacted and what PTs are of concern in them. And others have also used this study as a basis to do further work, like the presence of these PTs in the aquatic bioters, in the fishes, and in the rest. And so now we have a whole lot body of knowledge about the quality of the Lagos Lagoon in terms of the sediment quality, the water quality, the better content in the fishes and the shrimps and the rest, because of the work that was started about 20 years ago by us, which makes us very glad because it has stimulated people's interest in that aspect. Of course, Ibadan, where the university is located, have also been extensively studied by a group of team from our department. And of course, as I said earlier, we have also generated a lot of urban chemical maps, even for Ibadan, to show areas with elevated potentially toxic elements and areas with background value. So now we know what the quality of our environmental media is in those major cities based on the studies that these researchers have done over time. This slide shows the synthesis of the identified PTs in the various media that were set, and of course, we can see the matrices as mapped. So lead and zinc, of course, remain a major challenge to us across board, and it serves as the primary antagonist across virtually all the sample Nigerian urban media environments. This slide kind of, what I was trying to do is to talk about the evolution, how we have come from now and where we are now. This slide actually showed uh, how the pioneers worked, how it evolved over time, and where we are today. As I said, the Ajayis, the Oshibajo, the Oniawas, Hawks and Webb were the pioneers that we can identify working in the 50s, in the 60s, in the early 70s. And of course, the second cluster was catalyzed by our late supervisor and mentor, Professor Festus Abimbola, who threw in quite a lot of other scientists have now emerged over time. All the clustering you are seeing around there are people who are either have worked with or who have worked on their own, but one way or the other have had one thing to do with Professor Abimbola. So you can see how key he is to the advancement of environmental geochemistry and that in the country. And we are glad to continue to remember his legacy even as we go on. Of course, as the research work has evolved, equally institutional bodies have also evolved. The Nigerian Geological Survey is the overall body that oversees anything that has to do with geology in Nigeria. It has gone from being a separate agency to being a department and back to being a full-fledged agency now with oversight function on anything that has to do with geological investigation, the chemical mapping, and the rest. And because of the work they have done with the British Geological Survey in terms of mapping the geochemical baseline, some of the area, set of data have been generated that, in addition to using those data for mineral exploration, the data have also served as very good baseline data for environmental study. And so the former colonial department of geology, which was under the British stuff, had now evolved into a full-fledged agency, which we have. And of course, there is a separate agency established by government, which is the National Environmental Standard Regulation Enforcement Agency, just like the EPA after the US, or the Environmental Protection Agency in the UK. They have been charged with implementing a lot of initiatives, working with the universities and the rest to ensure that there are adequate investigation into the quality of the Nigeria environment. So we now have agencies that we can point to that have oversight responsibility on the part of government to do some of this work. And of course, I would like to quickly add this by saying that what have we achieved in the last, say, 2028? We have now established a very strong baseline for urban geochemical data in the country, and we have been able to identify what the causes of those hotspots are. We have been able to bring out those information to the public, either through publication or through engagements, like we are doing now, or presentation at conferences. Agencies have also developed along this path because government have seen the need to ensure that the environment remains a top priority in developing policies as regards the health of people. And even the ministries of health, of agriculture, of environment have become much and more involved in working with the universities to see that this data are not just data that are lying on the shelf, but they are used to actually form policies that can establish a better future. And what is the next phase? We have, as we said, enough of site-specific study. We now need to conduct detailed global geochemical mapping of Nigerian cities. We have a template to do that. We have the experience to do that. What we are now suggesting is that we must do a detailed global geochemical mapping of Nigerian cities. Our cities are not as pristine as some of us thought originally. Now, it is also to integrate those geochemical data into the National Health Risk Assessment policy initiative. We must work with the medicals to label them to understand that not all the diseases people are coming down with are from vectors. A lot of them are actually environmentally related. And I'm happy that a few of the people are actually working with us along this. We have now a center in National State University in North Central Nigeria that is devoted to the study of medical geology. You can do masters in medical geology and PhD in medical geology. And they have actually been well received by the populace. It is almost 20 years after introducing the first undergraduate course at Olabisi University for medical geology in foreign level. We have come a long way, but at least we are doing the right thing. We are also looking out for a strengthened agency that will be able to implement the law as it is. Has been a bit difficult. We know it is doable, but we as scientists and people in the field must continue to engage government so that the right policy will actually be implemented. Of course, the last but not the least, which we think is going to gain traction ultimately, is to develop a national geochemical database for sustainable development. It has been done in Europe. It's been done in a lot of countries. We believe we need to do it here in Nigeria. When we develop that national geochemical database, we can apply the data set across a lot of applications that will also assist us in our achieving the sustainable development goals. I want to appreciate all those who have been very instrumental to our work. Some of the work I'm able to do. Some of you are here, some are not here. I want to appreciate, of course, the pioneering effort of the Professor Shibaju and Ajayi, and of course, our late Professor Festus Abimbola, whose memory remain very fresh with us. I want to also appreciate quite a number of colleagues here who have also assisted in providing analytical assistance anytime we needed to do our work. Michael Watts of the BGS has helped very well. Of course, quite a number of our other colleagues have also provided access to quality journals. Robert Fickelman, Fiona Fordyce, and quite a number of people, just to mention a few of them. And of course, we have received good support from Professor Andrew Hothouse in Scotland. And anytime we reach out to him, it's always willing to help. And I'm happy to also inform that our current Madam President have also been very, very helpful in wanting to assist in ensuring that environmental geochemistry research in Nigeria is put in the right perspective. Thank you, distinguished ladies and gentlemen, for your attention.
Thank you very much, Professor. Thank you. It's never easy to get a round of applause online, but we'll do our best. So thank you. I would say, before I open the floor for questions, just to say thank you for providing that, I guess, comprehensive overview. And I love the fact that you did this evolution of methodology. Thank you. From the 1950s to the present day, from individual hazards to this more systematic mapping. And I think it's probably a lesson to us all that you also did a wonderful genealogy linking to the pioneers of the geochemical work that went on in the region, and then how you brought it all the way up to date. I think that's lovely, and I think we should probably try a little bit more in some of these talks for us to think about the evolution from our early pioneers. So shall I open the floor to any questions, please? So you can either put some questions in the chat and I'll read them out to Akinade, or you can pop your hand up and we'll take a question. So Dave, I can see your hands up first. Do you want to go ahead? Over to you.
Thank you very much for a great talk. I think one of the most valuable things that I think that we can share, particularly policy environments, is to see what works best in different places. I'm very conscious here we have a major issue with rogue waste disposal. We have plenty of laws in place that says, where waste should be going, but we have major problems with people who just do it illegally. So both the monitoring but also fixing it is a major problem. And I'm just wondering, from a environmental and practical point of view, does Nigeria have similar issues? And if they do, are there mechanisms that work well in Nigeria that we might think about here in the UK?
Yeah, I think our whole problem is even more exacerbated than that of the UK. The major challenge is actually clearing domestic waste. Most of it has been privatized, and you are supposed to have these waste collectors going from houses to pick the waste for a payment of a fee. But many people always want to dodge the payment of that fee, and instead of patronizing them, they just dump the waste somewhere and creating problem down the line. So it's a problem, but this cannot work. I don't think this can work in the UK. What we have done in Nigeria is that they've created specific time and hour in the month for cleaning. I think for the market space is done every Thursday between the hours of 7 a.m. and 9 a.m. They insist all the markets are clean and waste are dumped so that the waste collectors come to pick them. That is enforced. They don't allow any operation to start until 9 a.m. In fact, it's a fact in Lagos. And most states of the federation have actually copied that because they see that it works. The individual trying to dump stuff on the streets is a major problem, especially in the city of Ibadan. It has been difficult to get them to formalize into doing it. So in Lagos, they have some marshal that go around the cities at night. They call them neighborhood watch. Yeah, they are actually employed by the state government. They live in the neighborhood. They go around. So if you are caught dumping waste on the street, you are arrested and given a fine, either community service or you pay everything for it. So that has actually brought in some sanity in some parts of Lagos, but it is difficult to implement it across. So it's a major challenge. It's a major challenge. People don't like to pay for trashing their waste, even though they are the one that generated it. So it's a similar problem. Yeah.
Cool. That sounds like a good plan here. Yeah. Thank you.
Thank you. And I think you did mention, didn't you, the challenges of enforcement, Aki. So thank you. Are
Yes,
there any
yes,
other
yes.
questions? While people are thinking, can I ask one? You mentioned, which was intriguing, about the problems and the challenges of human sampling and biomonitoring. So, and you also talked about starting to have closer relationships with the health professionals. Do you see possibilities for the health professionals to be involved in some of this biomonitoring or sampling going forward?
Yes, there's possibility. I think what needs to be done is to continue the engagement with a lot of them. The training module for medical doctors and nurses in Nigeria creates a kind of system where they look as if they are self-sufficient on their own. But with the new thinking of total science, people are beginning to realize that you cannot stay in your cocoon and get answers to all your questions. So a few of them who are very innovative are already reaching out, and we're working with them. I remember Alex made reference to this when we met, I think it was in Manchester, how it is difficult to actually get a lot of medics to work with people in the environmental geochemistry. So it's the same problem. But we have a lot of people who are doing affiliated medical courses now, things like environmental health science, things like biochemistry, who are able to actually bridge that gap a lot. So I feel things will change. I know that there's a school, a nursing school in Nigeria that have actually introduced medical geology as part of their course in their training module. And that speaks to the fact that there's a change in thinking amongst the top echelon of the medical profession.
That would be incredible to see that change. So it'd be good to come and report back if you start when you start to see.
I will definitely
do in the UK and haven't perhaps managed to the extent we want yet. So thank you. And I'm sorry, I don't mean to hog the questions, but also thinking about, you were talking about what next, global geochemical mapping. And I'm wondering to what extent you feel that there's an opportunity to reach out to social scientists as well, to think about capturing some of that more survey or qualitative data from people's experiences of exposure. So if we can't biomonitor, kind of do the chemical analysis, can we try and capture some of the voices of the people through surveys or questionnaires or interviews? I don't know how much you reach out to social scientists or what opportunity there is for us to do that.
That is a nice tilt. One of the experience gained recently in the kind of research we did with a colleague from Cardiff University actually shows the potential in that line. The problem, however, is that people are not. It's difficult to get people to be honest when it comes to issue of personal health record because they don't still believe you enough and they're not going to use that record for something. So, but if it is possible to conduct this among those who are educated, enlightened, who understand the merits of such results for their own well-being, I think it is possible. It's possible. So it's something one can easily consider and look at.
Great, thank you. I wouldn't mind exploring that with you further in terms of how we go down that route, because I think it's something that the society can also engage with. I think Alex has posed a question to you, just exploring a little bit more about how serious is the lead contamination in children. Alex, I see you've posted it online. I've read it out. If you want to add any more, please do.
I can't find how to raise my hand.
Okay. Hello then. Over to you.
Yeah, I was with the huge amount of lead that you're finding in the urban areas, and you've got some medics on board. Are they looking at lead contamination in children?
As I mentioned earlier, we have not been able to really have this study on the human, but there is some good light coming in that direction. The Ministry of Health in Lagos convened a technical meeting just last week. I was briefed by one of the geologists that attended the meeting that there is this initiative from the Ministry of Health about lead poisoning, and they are trying to see what level of prevalence of lead poisoning or lead contamination is in human in Lagos. Now, the colleague, when he went in there, went in with some of the reports we have generated and told them, this is something we have been agitating for, this is something we've been asking for. But that is coming from the Ministry of Health. You know, the request is not coming from the Ministry of Health. But they were excited when they saw some of the reports that kind of put them on the alert that if we have this much lead in the environment, then there must be a problem. So they have a smaller committee was set up to now see how we can take this study further, especially from those areas with the hotspot, and see what impact it really has had on humans. And of course, that will include the infants as well. Since it is coming from the Ministry of Health now, I can tell you it's going to be much easier to work with the people and be able to get through that barrier that has been there originally.
Thank you.
Thank you.
That's
I'll just say, Alex, somebody responded online too, just so you know, that says the Ministry of Environment in Ogun State is also working on research on lead poisoning within the state. So developments.
Yeah, that's good. That's good.
Thank you. Are there any other questions? So I'm going to ask another one in that case. Can I ask what before I pass to Dave? You mentioned that the kind of the Nigeria EPA equivalent has been established. How far have they got in terms of developing local soil guideline values or blood lead level guidelines? Are they available now? Are they?
They have some guidelines, but most of the guidelines, from what we have seen, have not resulted from empirical data generated locally. They've actually been more or less an adaptation of what they have in the UK or the US and the rest. And for us, that's not acceptable. So you can't compare our level of urbanization with that of the UK or that of the US. So we have canvassed the need to develop a Nigerian standard that will be based on the Nigerian data set. And so far, we have not received some traction on that. You know, it's difficult to convince government sometimes.
Slow process. Thanks, Dave.
Well, actually, my question is very similar to Jane's. I was really interested in the extent to which those regulations reflect the local environment and the local population, because it's an issue everywhere, not just in Nigeria, but in many countries. There seem to be default values that are like quite often taken from US EPA reports and then just blindly applied because it's a simple and maybe a safe thing to do. My question really is, are there any ongoing processes in Nigeria to update any of these regulations, either for soil or for drinking water? And is there an opportunity for the global community to input into that process with local partners?
I know that there is a process for that of water quality. There's a water quality standard that was reached, and some of the local colleagues were involved in getting it. But, you know, just as I mentioned earlier, what happened in most of the instances where data either from WHO, from the more advanced countries were just adopted. And my own take is we can have our own national standard on the basis of what we have, especially when they are verifiable data. And that is the challenge. But I knew there was an attempt one time to review the water quality data. But for the soil quality data and the other, no, there's no effort in place now. Hopefully, maybe when things calm down after the next election, maybe we can continue to pursue along that line.
Cool. Thank you. Thank you.
Great, thank you. I'll just wait a moment. If there aren't any further questions, I think we've given you quite a serious grilling, Akinade, about everything that's going on in terms of geochemistry and environmental regulation in Nigeria. But it's a great opportunity to hear what's going on. In which case, thank you again for spending your time this afternoon and a wonderful overview of the people and the activities that are going on across environmental geochemistry and health in the country. Somebody's just asked in the post, what is NESRIA? I think that's your EPA equivalent, isn't it?
Absolutely, yeah. It's just she wants to know if they are doing anything about it. They are not. They are rather interested in doing environmental impact assessment of projects. That's what their focus is on now. So all these standard developments, they are not interested.
Okay, thank you. Thank you, everybody, and thank you for your attendance. And just before we finish, I will also flag our next seminar will be with Alekos Demetriades. Sorry, I'm not a very good at Greek pronunciation, Alekos. I see you're joining us, and I think you are presenting your talk on the 2nd of June. So that'll be the next opportunity for us to get together as a SEGH community. So thank you again, Aki. I look forward to seeing you again in due course. Thank you.
Thank you.
Thank you, everybody.